So hi everyone, a very good morning to all my dear students and welcome to today's transform session, right? And today I'm going to be alone. Dr. Sumer has been invited for a convocation ceremony. So I'm going to be here with you and we are going to talk about a very important topic because we had been constantly getting these queries and we thought that this is the right time to address it so that the students can work on it, right? So do you all know what we are going to talk about today? Yes? Okay. So yes, I'll first talk about the most important topic, and that is how to beat silly mistakes in exams. And I'm sure when I talk about that, a lot of you will resonate with me, and I want you to tell me that is silly mistake your demon? Yes? Should I start with that? How many of you feel that silly mistakes has been taking a toll on your number of correct questions, and sometimes it really makes you sad post exam that why did you make those errors? So the first thing I want to say is that silly mistakes do happen. Even toppers may do it, right? So it's not unique to anyone. Even if I go to the exam, I might be doing it. But what is the key? The key is that we have to keep these silly mistakes to minimum. Yes, do you all agree? हो सकता है कि silly mistakes अभी भी हो, मगर what differentiates us to be a high scorer is we have to keep the silly mistakes to minimum. Do you all agree? Okay, so I'm going to talk about some key things which I feel are very important when we are talking about silly mistakes. See, yes, Ruchita is saying that at times I don't even realize what I have marked. Exactly my point. Okay. So let's talk about the first important hack to ensure that we are doing minimum number of silly mistakes. Do you know what is the first and the most important hack? Because I've been doing a lot of quizzes, a lot of test papers with all of you, and when I see the mistakes you make, I realize, oh, this was what my student did not catch this, right? So the first and the most important thing is to know what the question is exactly asking us. Yes? Can you tell me how do you know what exactly the question is asking us? What is the key to that? The key to that is reading the last line. Okay, please remember in NEET PG, you're likely to have more clinical vignette pattern questions as compared to NESET. NESET had a lot of one-liners, right? So when it is a clinical vignette type question, even if it is a short clinical vignette or a long clinical vignette, the most important thing is the last line. A lot of times what happens is when you're reading the question, you assume things. Does it happen with you? Yes, you assume things and you very easily neglect what exactly the question was asking. For example, please understand this. When you go to the last line, you will see that the most important keywords are written there. For example, what is the next appropriate step in the management of the patient? Yes, do you all agree? And I'll give you a typical example. Wherever possible, I will keep giving you examples. For example, there is a very important topic called as impending eclampsia. Yes, IE. And we will say that the girl or the woman has come with this kind of blood pressure, let's say 160, 110, and then we will say she has headache, she has epigastric pain, she has blurring. So they all tell us that she is a case of IE. है ना? Now, if I ask you what is the next appropriate step in the management of the patient, right? Or what is the next best step in the management of the patient? Can you tell me what would be the answer? Because it's very essential. The management of the patient will have three components. Do you agree? Yes. The management is you want to prevent seizures, you want to control her blood pressure, and you also want to do termination of pregnancy. So all are part and parcel of management, and each component is important, right? But they may be three separate options. Now, it's not that you do not know the question or you don't know the topic. You know the topic. But when we have asked you the next step in the management, yes, the single best answer is MagSulf. At this point, our key is to prevent the development of seizures. Do you agree? Yes? So it is very, very essential that we understand what the clinical vignette is and what is it trying to ask. Is that understandable? Now, sometimes there are two options. For example, you will say, ma'am, controlling blood pressure is also important. I agree. Yes, but still the next most appropriate step is preventing the seizure, because if that happens, it will worsen the morbidity and mortality rate. Also, blood pressure will take some time to control. It won't happen right away, right? So you give the loading dose of Magsalve and then you add the antihypertensives. Is that understandable? So please focus on the last line, especially when it's a clinical vignette. Understand what it is trying to ask you, right? All three are management, but what are you going to do first? And that's where algorithms help. That is why when you go to DVT, when you go to LRR, you will see, or even your TND notes, you will see a lot of times we have been teaching you to go in the form of algorithms. This is what you do next. This is what you do after that. This is what you do after that. Is that clear to everyone? Okay. Now I come to point number 2. Okay. I have seen the second very important reason why we land up doing silly mistakes is because we are not reading the keywords. So now, how many of you are going to tell me that when you are working on the MCQ, you really want to do it at a very fast pace? Can you tell me? How many of you have a habit of going at a very fast pace, and as a result of which you miss on some keywords and then you say, oh, isme ye likha tha, and that is why I missed it. Yes, does it happen with you? Yes. Okay, so it's very important to not miss on keywords. Now, how do we ensure we are not missing on keywords? So, when you sit with hard copies of test papers, we have a habit of underlining keywords. How many of you have a habit of underlining the keywords when you are doing a MCQ practice at home? Do you underline, especially with hard copies? I always used to do that. But what is the problem? The problem is in the real exam, you cannot underline. Do you agree? Yes? And that's where we face a problem. So how do we cater to it? Because now I can't underline the keywords. So how do I cater to it? So the best bet is read it a little loud, not very loud to disturb everyone in the room. But when you're reading the question, focus on keywords and as if you are speaking the keyword to yourself. For example, it is very, very essential that, when we are approaching an MCQ, did the question mention some keyword or not? For example, in my last, Telegram quiz, there was a question I asked, which is about red degeneration of fibroid. Yes? Now, some of you are confused between options. You will always be confused between options. The MCQ is not going to be difficult. It's always about options. Yes? So if you realize, typically in that question, I gave the patient with acute pain, I gave her as a case of fibroid, and I gave second trimester. Do you understand this? Now, yes, very good. Abhishek has given one more important thing that we can use. We can use the mouse. When you are reading, you can move the mouse along the MCQ. Yes? Or as I said, read the keyword to yourself. Now, there is a hack that I want to tell you. If it is a clinical vignette, let's say it's a 3-line question. Okay? Generally, every line will have one keyword. There are not many keywords. Most of the times in a clinical vignette, every line will have one keyword. For example, in one line, I will say she is a known case of fibroid. In the second line, I had given she's come with acute pain. And in the third line, I gave the hint that she's in the second trimester. So then when you put them together, you realize this is the classic case scenario of red degeneration, right? And that is why it is a better answer than torsion. Okay? Torsion will only happen if the fibroid is pedunculated. I didn't mention pedunculated. So the key word for torsion is pedunculated. Do you understand this? If it is not pedunculated, it is not likely to undergo a torsion. So this is why you need to pay attention to keywords of everything. Do not miss. Do not presume. That is very important. Whatever information is given in the question, it is given. Nothing more, nothing less. You have to work out between options with the information provided to you. Do you understand this now? Yes? Is everyone clear? So please remember, every line in a clinical vignette will have usually one keyword. You put them together, you read it again to yourself. For example, this is what I did, right? So what did I do? I said, I have read the keywords together, right? So one keyword was known case of fibroid. The second keyword was pain. The third was second trimester. Is that understandable to everyone? Yes? Okay. Then let's go on to the next important third point, how you can avoid silly mistakes. Are you all ready for the third point? Because the third point is the one which hurts most. So now I want to ask you, how many of you feel that you do silly mistakes in easy questions? Can you tell me? Yes? Come on. Tell me, how many of you feel that your pain point is you are able to do the difficult questions nicely and you do less mistakes in twisted and difficult questions? But when it comes to easy questions, you are doing more silly mistakes. How many of you feel this is your pain point? Yes. See, this is exactly what I said. And this is what I have observed when I am doing lots and lots of questions with all of you. So when I see the kind of doubts you have, I realize these students have done the difficult question correct, but they've done the easy one wrong. And then I was thinking, why? Why did it happen with my students? Yes. So do you want to know why does it happen? Because when you see familiar looking questions, okay, so when you see familiar looking questions, for example, oh, there was a question like this in PYQ, right? It is familiar looking, it is not same. What do? You tend to go very fast in it. Yes? So this is the problem. Now listen to me very carefully. You need to slow down in easy questions. If you go very fast in the easy questions, you are missing on keywords again because you're presuming it to be a previous year question. You're presuming it to be something that you have seen. So you tend to go very fast. Please spend 5 to 10 seconds. Read the easy question slowly. Are you all going to promise me that you're going to do that? I'm not saying go very slow, but take a pause. Okay, please take a pause, especially in the easy questions, right? They are familiar looking, but they may not be the exact same question. They would have a twist in them. Yes? Do you understand this? So you need to be very, very cautious. Spend 5 to 10 seconds extra. Don't overthink. Please understand this. In easy questions, we don't want you to overthink. Me and Dr. Sumer have said that multiple times. If it is an easy question, which means it is directly from your class notes, you are going to go with a kill. Do you understand this? No overthinking. You're not going to think, do I shoot or not? Shoot. But take 5 seconds, read keywords again, and then say, this is the information provided to me. With this information, this is the best answer. In easy questions, the second reason of why you do mistakes is you overthink. You presume, oh, this has come in the exam, it cannot be this simple. So now, the next very important point to ensure that you're not doing easy questions wrong is when you are confused between two options, and this is a hack that I have given previously as well. So if you're confused between two options, there is one option which seems very obviously correct, okay? It seems obviously correct. For example, again, I will take the red degeneration and torsion question. Red degeneration seems obviously correct. But then, how did you approach? You said, oh, but there is no fever written. There is no leukocytosis written. Maybe then, therefore, the answer is torsion. So what were you doing? You were doing overthinking, right? Because you made one option correct by thinking, had this been there, had that been there, then the answer would be this. So if it is an easy question and you are confused between two options, you will go with the one which is more obviously correct rather than with the one where you have done a lot of thinking. Is that understandable? Yes? So this was the third point. Slow down a little in the easy questions. Take 5 to 10 seconds. Ensure you have not missed on any keyword. Yes? Are you good with this? Okay. Now, coming to the fourth hack. Okay, now I'm going to talk about the fourth hack to avoid silly mistakes. Do you know what that is? It's a very simple thing that we have been insisting on. And the fourth hack to reduce your number of silly mistakes is please avoid changing answers. Do you understand this? Right? You will not change answers in many MCQs. Keep it to minimum. Okay? Because when you do that, you again tend to make a judgment error. Okay? Now, what are the only conditions where you will change the answer? Number one, you will change the answer when it was a recall and a very clear factual thing that you have done wrong. Okay? For example, let me tell you, suppose I ask you in a post-menopausal woman, beyond what thickness should you do an endometrial biopsy? Beyond what thickness of endometrium on ultrasound would you do a biopsy? Now, this is a very clear factual question. Yes? So, beyond what thickness? Beyond 4 mm. But let's say in your first go, by mistake, you've answered it as 3 mm. So, this is a very clear factual mistake. And then, yes, you should change an answer. Right? So you will change the answer only when, number one, it was a very clear recall error. Okay? If it is a very clear recall error, then change the answer. Second, when it was a reading mistake. I was going through the question, but when I read it for the first time, I missed an important keyword. Right? And now when I read it again, I realized. So if you have spotted a reading error, which you made in the first go, then yes, you can change the answer. Is that understandable to everyone? So you will change the answers to minimum. Okay, go with your gut instinct or your first instinct. Yes, keep it to minimum. Change answers only when A, it is a very clear recall or a factual mistake that you have done. Two, it was a reading error. When you read the question for the first time, you read it incompletely or inadequately. Now you had time, you went back, you read it more thoroughly, and yes, you spotted your error. Okay, is that clear? Next, yes, I will tell you what to try in the upcoming CBTs. Now, the next problem, again, which is a very common problem. Sometimes you know the answer. Am I right? I mean, you see the question, you know the answer. But how many of you do a mistake of not reading the other options? Can you tell me? How many of you say that, okay, A, B, C, D, I know it is A, so I will not even read B, C, and D. How many of you do that? In some questions, you don't even read the other options. Let me see if I have some of you in the chat box who do this kind of error. See, again, so many of you. And I'm telling you, the more I get connected with my students and I analyze your mistakes, these are the points that I wrote down over last one day, analyzing the kind of mistakes the students are doing. Please don't do it. Use elimination before selection. Remember, it is an MCQ exam. The options are going to be very close. Please don't do this mistake. Read all options. Always work with elimination as compared to selection. It is an art of MCQ solving. Suppose you have A, B, C, D, you've selected, you say A is the answer, but not even gone through B, C, D. Please go through B, C, D also and rule them out. Oh, this is written in option B. It is definitely wrong. Okay, this is mentioned in option C. This is also wrong. Do you see, when we do a test and discussion with you, when we are doing the predictor series with you, whenever we are explaining you in all DAMS explanations, what is the methodology Dr. Sumer has kept for every teacher? Where the guidelines are, you tell why A is the answer, but you also tell why B, C, D are not the answers. It's very important. So all of you students will now you will ensure that you use the elimination method in MCQ solving rather than selection method. Is this clear to everyone? Yes? Always rule out other options. Are you with me? Yes, everyone? Okay, so this was the fifth hack. Use elimination over selection. Are you ready for the next one? Are you ready for the next one? Okay. The next problem which I feel students have where they make mistakes is when they get overwhelmed with time scenarios. Yes. For example, I am doing set A, and this was a problem a lot of students had in any set. I am solving set A. I was slow. And then I realized in set A, I only have 5 minutes and I have 10 MCQs to solve. What happens then? Then you get overwhelmed. You say, okay, let me just quickly mark whatever comes to my mind in those 10 MCQs, and you do silly mistakes. So it's very essential for everyone, no matter how confident you are. Okay, it is very, very important that you practice in time blocks. Some students were telling me, ma'am, please GT में से time block हटा दो. No, I will not do that. You have to practice in time blocks. You have to know how to tackle if you have slightly less time, and you have to know how to tackle if you have time left over, because leftover time is also very dangerous. Suppose you have 15 minutes left and now you say, okay, I will review all my answers in this block. And when you review, you change more. So you have to have just the right amount of speed to ensure that you're not overwhelmed with time. And for this, you need to practice more and more grand tests, mock tests, which have time blocks. All of these students who have a problem of getting overwhelmed with time, you need to practice more for the sheer purpose that you're not missing on easy questions. Some students came back to me after INI set and they said, ma'am, mere 10 questions reh gaye, and out of those 10 I actually knew 8, and it was so sad, right? It was so sad. Also, what is the problem? If you leave 10 questions in the first block itself because of time, what will happen to other 3 blocks, and in NEET other 4 blocks? Now you're again pressurized because you can't leave a lot of questions in other blocks. You've already left 10 in first block. Okay? So is this clear? Is this helpful for everyone? Okay. Now, I am going to tell you the next hack which you all have to practice in the last 20 days now. You are going to maintain an error log. For example, suppose I am giving 20 MCQs in my Telegram every day for all of you to practice. After that day or towards the end of the day, I want you all to sit and write what were the kind of mistakes I have done. And you may come across a pattern of mistakes. For example, some students will realize every time their mistake is misreading the question. Some students just misread it. They're in their own zone. कुछ नहीं भी लिखा है लेकिन उनको वो दिख रहा है वहां पे ये लिखा है, because probably you have mugged up some MCQs. Yes, so when you mug up MCQs, you see it the way you want to see it. Now the question that comes in the exam is very different from the PYQ, but you feel ये तो PYQ है, right? So some students will find a pattern in their mistakes. One of the common pattern is misreading. Okay, you always misread the question and that's why you do the mistake. The second common pattern is overthinking. Some students are always doing mistakes because they're always overthinking. They're always unsure. They're not going for the kill, right? A भी हो सकता है, B भी हो सकता है, ये तो एग्जामिनर ने ही खराब बनाया है, ऐसे MCQ तो बनने ही नहीं चाहिए. Yes, you're always overthinking. And the reason for this is content. Okay, content, your content, जो भी आपने पढ़ा है, that content has not given you some vital concepts. Okay, it is lacking in content, and that is why whenever the options are closed, you don't know how to solve them. So you're always thinking, ये भी हो सकता है, ये भी हो सकता है, ये भी हो सकता है. Any बच्चा who feels All three could be the answers. The problem is with the examiner. The problem is with the people who have made this paper. They're stupid. No, the problem is you. Your content is inadequate. You don't know how to select between options. Okay? Please, I am trying to be very brutal because you still have time to work on it. Okay? If I tell these things after exam, they will not help you. Right? So my purpose is to help you when there is time, not retrograde. Okay? So please understand this. If you are a student, see, believe me, even if I go for the exam, there will be some questions where I am confused between two options. It is very obvious because it is a paper, it is a stressful environment. But the difference will be the number of questions in obs and gynae that I will be confused in will probably be one. But if your content is inadequate, you will be confused in two or three options in almost 60-70% of the paper. So now you still have time. If you are someone who has problems in selecting options in more than or equal to 60% of the paper, okay, then your problem is content. It's inadequate data. You don't have the vital information to rule out options, and that is why you feel ye bhi ho sakta hai, ye bhi ho sakta hai, ye bhi ho sakta hai. So there is still time. If you are someone and you feel that in every MCQ you are confused in options, then you should work on content. Yes, doing DBT will really help you. DBT is made in the format where we know what my student needs. It has those keywords, it has those algorithms, those tables, those next steps, those organisms, those investigations which trouble you. So that is why we said in the last 20 days, we have to do something which should help you with reflexes. 50 to 60% of the paper should be reflexly done. That should be the level of confidence we have. Yes, in remaining 20-25%, we will have to think because they would be very close options, and maybe 5%, the difficulty level is higher. Everyone will have a problem. You don't need to worry about it. Is that clear? Okay. Yes, DBT के लिए भी बहुत time है. I'm telling you, even if you do keep last 10-15 days for DBT, it is very good. Okay, you will be able to do 2 readings. Everyone will be able to do at least 2 readings in last 15 days. If you are good with your content, you may be able to do even 3 readings. Okay. Now, coming to ma'am, what else can I do to improve my accuracy and to reduce the silly mistakes? So what else can we do? Now, for example, you have to understand that you will have to have some visual aids to ensure the silly mistakes are less. Okay, that is exactly why we have made the DBT book in the form of a visual aid where you don't have to think a lot. It is just helping you with the key things, right? So DBT not only gives you the content, it gives you the right visual anchors. देखो हर चीज का कोई visual anchor होता है. For example, I don't know, this entire year I have been saying you are going to get question on granulosa cell tumor. Did it come in NEET? Yes. Right? So when I was showing the Carl Exner bodies in class, I also show the coffee bean with it. If you've attended my class, I actually show you the real coffee bean, right? Showing you the groove, right? That is a visual anchor. So I show this and I said, keep in mind, this is something about this is going to come in the exam this year. So, when you go to the last 20 days, you need to have more visual anchors so that a lot of things come in reflexes. Will DBT give you that visual anchor? Yes. If your content is quite weak in a particular subject, even LRR will give you those visual anchors, right? Because in the LRR, we have again put only those things which we know will help to solve questions and will help in elimination. Is that clear? Now, are you ready for the next hack? This is a very important session. So I'm spending some time giving examples as well, because I feel silly mistakes is really the problem issue. Okay. Now, the next important thing, and you're going to practice it today for next 2-3 days, and then you will come back and tell me, did it work for you or not? Are you going to promise you're going to practice what I'm going to tell you next? Now, for everyone whose problem is silly mistakes, we need to train our mind. Okay, how do we do it? Train your mind by taking one take of MCQs. For example, you will say in next 2 days, whatever MCQs I am solving, I will try and do them in one take. Do you understand what one take means? It means I will not read it again and again and again. It will reduce the problem of overthinking. For example, I will train my brain and I will tell my brain, I will read every MCQ a little slow. Okay? A little slow. I'll take 5-10 seconds to read extra, but I will read it only one time. And today, tomorrow, and day after, whatever MCQs I'm solving, I will do them with one take method. Yes? So I want everyone to write in the chat box, are you going to take the one take method today, tomorrow, and day after, maybe 3 days? Yes? And then you will come back and tell me, is it improving your accuracy or not? Please do it. You know what happens? This way, you also trust your preparation. Trust factor is very important close to the exam. We all need this trust that close to the exam, I'm good enough. I'm able to recall things. I'm able to retain it. I'm able to reproduce it in the exams. So when you use the one take method in MCQ solving, it brings the trust in the process and you will be better on the day of the exam. But this is something that you need to train your brain for. It won't happen one fine day. And that is why I am saying, let's take next 3 days and let's do this promise to ourselves that whatever MCQs I'm going to do in next 3 days, I'm going to go a little slow, but I will do the one take method. I'm going to read the MCQ only once. You can read the options, eliminate them, because I've told you, use the method of elimination. So eliminate करना है, मगर MCQ बार बार नहीं पढ़ना है. ठीक है? Are we good with this? Yes, everyone? Now, are you ready for the last hack? So we finally come to the last hack that I could jot down for all of you. And that is, keep some mental checkpoints for yourself. Okay, for example, when you are finishing or doing a question, it has to consciously come to you. Have I read the stem of the question properly? It is a mental check. You have to keep asking, have I read the question properly? Have I read the last line? Have I identified the keywords? Ask, okay, practice this. Ask yourself. That keeps you under check. For example, ask yourself, am I in the right time frame? Okay, am I not going very slow? Am I not going very fast? Mental checks are very important. Otherwise, you get distracted. This is a very common, again, problem that some students bring to me. Ma'am, there were a lot of distractions around me, and that is why I landed up doing silly mistakes. Okay, how many of you feel the environment around you distracts you? Yes, because sometimes the fan speed will be there, sometimes you're going to be very sweaty, sometimes you're going to be very thirsty, someone next to you might be making a lot of noise. Does it happen with you in the real exam? Yes or no? Yes. If you are someone who is affected by your circumstances, you need to keep certain mental checks, because that will ensure that your brain is focused on the exam and not things around it. So every time you are sitting for a time slot, ask these mental checks. Am I on the right speed from the first question? Have I read the clinical question carefully? Have I eliminated the other options or not? Right? When you ask these questions, your focus is brought back to the exam rather than things happening around you. Right? So these are some of my tips and tricks which I have made after seeing how or what kind of mistakes my students have been making over last few days. And that's why I decided to do this topic well in time. Okay. So yes, I will quickly summarize all the points that I've written for my students. Number one, read the last line very carefully to know what exactly the question is asking. Number two, move the mouse along the clinical questions so that you don't miss on keywords. If you can't move the mouse, speak the keywords to yourself. Okay, that is point number two. Point number three, if it is a easy question, slow down a little. Don't be very impulsive. इतना impulsive नहीं होना कि MCQ भी नहीं पढ़ा पूरा, right? Slow down. Take 5 seconds extra to read that question. Only read, don't overthink. Okay. Hack number four, avoid changing answers. I said you will change answers, number one, only when you see it was a gross recall error on your part. Yes, obviously change it. Number two, change it if you see it was an error in reading the question. You had read it incompletely, you had missed out words, then yes, change the answers. Otherwise, keep it to minimum. Hack number five, use the elimination method, not the selection method. It means even if you know A is the answer and you're quite confident about it, rule out B, C, and D. Okay? So it should not happen that I did not even read the options. Please read the options. Okay? Hack number six, practice in time blocks because time is very precious. It overwhelms you and you land up missing on very easy questions because of time management problems. Everyone should give the CBT, go to the centers, get accustomed to the environment, get accustomed to the training process so that these kind of errors are minimum in the exam. Okay. Then I said maintain an error log because every student is different. Some students are always making overthinking errors. Some students are always not reading the question completely. So if you find a pattern in your mistakes, then you have the clue how to work on it and you can really reduce it in the real exams. Okay? Last, I said it's very important, or second last, I said it's very important to have visual anchors, right? DVT. Please use DVT as your visual anchor. It has exactly the words that you need, exactly the algorithms that you need, exactly the images that you would need for your exam. So use visual anchors. Then I said for next 3 days, practice the one take method of MCQ solving. I said the one take method is I will read the question only once. I will read it a little slow and based on that I will practice the next MCQs over 3 days and then I will see is that helping me reduce the errors or not. I am not saying don't read the options. Please read them. I'm just saying read the question once and do the one take method, especially for students who do overthinking. Okay? Lastly, I said in the examination hall, keep mental checks to stop getting distracted and maintain your focus. Okay? So please remember the first thing or way to keep a mental check is ask yourself, am I going in the right speed? Second question, am I reading the clinical questions carefully? Have I read the last line? Have I eliminated the other options? So keep consciously asking these questions to keep your focus on the exam itself. Okay. So yes, so those were my tips and tricks. I hope they help you. I really want my students to reduce the number of silly mistakes to bring up your scores massively. I think these will help because I have found out these problems only while I have interacted with all of you over these last Telegram quizzes that I have been conducting, the predictor series that I've been seeing, and the Transform 10x series that I'm seeing. Okay. Now, the last few things, please do the today's Transform 10x test. It is based on all SARPO subjects plus FMT. So I have put all short subjects together. Okay, SARPO, so skin anesthesia, radio, ortho, and psychiatry, along with FMT. There is a common test for today, 30 MCQs, transform 10x. Everybody should do it. Second target, please give the predictor series test of today and attend the live discussion at 3 p.m. on YouTube. Yes, and yes, PYQ ka baap. Don't miss on that. PYQs should not be your silly mistakes. You should be strong in PYQs and PYTs. Lastly, I'm going to wish all my dear students best of luck for the NEET results. Let the best people get the best scores. Okay, so everyone has tried to do their best, so let's just leave it at that. And I'm sure that um, most of you, I hope, do not feel disappointed. Please understand what I have said previously and Dr. Sumer has said. Exam is not or exam result is not a reflection of your worth. It was just one day. Let it be. Even if it doesn't go up to your expectations, please don't be very mean to yourself. Don't attach your self-worth to it. Think that there is a bigger opportunity coming my way and I have time to work on it and to get better, to improve my choices. Learn from your mistakes. That's what keeps us moving further, keeps us getting better and better, right? So don't worry. We are with you no matter what your result is. We will stay with you for next days as well to ensure that you perform up to your expectation in NEET PG. Okay? So best of luck everyone, but don't just keep thinking for the result. Convert your day into a productive day, and the best way is to meet the targets. Usually you're not able to give targets to yourself, so I have given them to you today. Transform 10x 30 MCQ test, predictor series test, PYQ ka baap are must do's, right? And let the exam result wait somewhere in the corner of your brain. Okay, so all the best. We are with you. Take care. Good luck. God bless you all. Okay, thank you so much. See you again.